Hello, thank you for joining. Today, I'm going to very briefly review some of the work we're doing on gene therapy for age-related macular degeneration, diabetic retinopathy, and retinal vein occlusion. These are among retinal vascular diseases and are common causes of vision loss. The vision loss is mediated by overproduction of vascular endothelial growth factor, or VEGF. What VEGF does, it causes the vessels to become leaky, and as a result, the tissue becomes swollen. In this case, retina becomes swollen. We call it macular edema, and that causes vision loss. Another thing that happens is with overproduction of VEGF, new vessels can grow. These vessels are not like normal vessels. They can easily bleed. They can cause a scar formation and can cause retinal detachment and severe vision loss. We do have a treatment for these conditions, and the treatment is delivered into the eye by injection. We call it intravitreal injection. With these injections, we deliver medications. All of these medications, in some ways, block VEGF and prevent that from binding to its receptor and doing its harmful effect. There are about 8 million injections into the eye every year in the US alone, and $10 billion spent every year in the US alone. As great as these medications are, there's a big problem with them, and that is the need for frequent injections. In some cases, we have to do the injection as frequently as every 4 weeks. With that comes a lot of inconvenience. The cost could be quite high. But more importantly, there's a risk of vision loss if for any reason a treatment is missed. And unfortunately, we see that happening in real life. Sometimes patients get hospitalized or for other reasons cannot receive the treatment. And by the time they come for treatment, the vision loss cannot be recovered as much as needed. Therefore, there is a real need for a longer-standing and permanent treatment, and gene therapy has the potential to deliver this. So in my lab, we're using CRISPR-Cas9, which allows precise gene editing to modify VEGF gene and reduce the amount of VEGF. When we do that, the effect is permanent. So whatever we reduce in the amount of VEGF is permanent and should eliminate the need for frequent injections. For example, in this case, this is the code for VEGF-A gene. We targeted a small area for gene editing in the early part of the gene highlighted in red here. First, we constructed a piece of DNA, a small piece, to test our CRISPR-Cas9 on that. And we noticed that the gene editing happened in exact location that we wanted. Next, we have to do this in cells. We're not going to do gene editing in the whole body. We're going to only modify VEGF gene in cells that produce VEGF in the eye. And these cells are RPE cells and Mueller cells located in the retina, which is light-sensitive membrane in the eye. We used a lipid nanoparticle to deliver CRISPR-Cas9. We have to use a vehicle for delivery. And we tested these in the dish in cells. What we found was that when we employed the same technique, we actually saw gene editing happen in cells, and we saw it happening in exact location. But what is more exciting is that this gene editing resulted in significant reduction in amount of VEGF. That's, after all, what we want, to see the VEGF amount is reduced. And in this case, you can see that in RP cells, we had 43% reduction, and in Mueller cells, we had 38% reductions. So this is proof of concept that gene editing can actually achieve reduction in the VEGF amount. Now, the effort since has been focused on improving the condition. So we've tested on different cells. We are employing different methods to improve efficiency, including targeting different areas of the gene and also targeting some areas simultaneously. Currently, we are working on improving the lipid nanoparticle delivery of CRISPR-Cas9. the delivery into cells is actually quite important. The more cells we can deliver to and the more safely we can deliver to, the more likely that we can achieve our goal. And our efforts in the future are still going to be focused on further optimization of all the steps. If you want to have a treatment that eliminates frequent injections, we have to access as many cells as possible and reduce the amount of VEGF as much as possible. But also, it's very important that whatever we're doing is completely safe in the eye. That is something also we're working to ensure its safety. With that, I would like to thank you for your attention. The work that we've done has been funded by NIH and USC, and generous donations by some individuals that I'm always grateful. And if you would like to participate and be part of this journey and help to bring this treatment to the clinic to patients, you can scan this barcode and directly takes you to donations. Any donation will be greatly appreciated. And if you have any question, you can contact Sylvia Alexienko by phone or email. Thank you again.